Today I want to talk to you about when and when not to use an antigen test. So firstly, when to use an antigen test. You should only consider using an antigen test as an additional tool to combat COVID-19 if you have no symptoms of the disease. If you have been vaccinated and have no symptoms, but have been identified as a close contact of a confirmed case, you should use 3 antigen tests over 5 days to check that you have not picked up the virus. The HSE will provide these tests to you for free once you're identified as a close contact. Now, at present, given the very high incidence of disease in Ireland, we are asking everyone to reduce their social contacts. However, we recognise that some people will continue to regularly engage in higher risk activities, like attendance at bars, restaurants, nightclubs, the cinema, multi-household home visits, participating in indoor contact sports, and car sharing with people from other households. For those people, it is recommended that they self-test twice a week as an addition, not an alternative, to other basic public health measures. This may identify that they have picked up the virus at an early stage and prevent them from spreading it to others. If your antigen test returns a positive result, you should self-isolate immediately and arrange a PCR test. If your antigen test does not detect the virus, in other words a negative result, you still need to keep up all the other protective measures like keeping distance, mask wearing, ensuring good ventilation and hand hygiene. This is because antigen tests may not detect the virus even if you have it. Now, when not to use an antigen test. So you should not use an antigen test if you have any symptoms of COVID-19. Instead, you should self-isolate immediately and arrange a PCR test. You should assume that you have COVID-19 until you receive a negative result from a PCR test, and you should continue to restrict your movements until 48 hours after your symptoms have resolved. Unfortunately, we know that the majority of people using antigen tests in Ireland are symptomatic, and that the majority of people with COVID-like symptoms in Ireland are using antigen tests. This is contrary to public health advice. Of those who are symptomatic and receive a negative antigen test, the majority are interpreting that result as a green light, with just 1 in 3 people going on to self-isolate and arrange a PCR test. It is essential that no one with symptoms interprets a negative antigen test result as meaning that they do not have COVID-19. It's important that you follow the guidance on how to use antigen tests correctly, and there's lots more material, including videos on how to do these tests, available at hse.ie. Thank you.